Hi, good morning everyone. This is Divya. Welcome to my channel Aries Diet, Eat Right, Future Bright. So as I have told you that I'll be posting videos soon as possible. So today I'll be discussing about the topic which is very common nowadays during pregnancy. It is gestational diabetes. So let me tell you what is gestational diabetes. So gestational diabetes is a kind of diabetes which is pregnancy induced. Before conceiving, you don't develop this diabetes. This diabetes basically develops during pregnancy and precisely between 24 to 28 weeks. In this diabetes, the woman is not able to produce enough of insulin. Now, what are the causes of gestational diabetes? Firstly, if you are having any genetic thing, like if your parents are having diabetes or if your grandparents are having diabetes, so definitely you may have this gestational diabetes during pregnancy. Second is your age. Like most of the women nowadays are conceiving at very late age, right? So at the age of 38, 39, if you are conceiving, so you may have this gestational diabetes. Third is obesity. If you're obese before conceiving, or if you have gained a lot of weight during your pregnancy, so you're definitely prone to this gestational diabetes. Then if I'm talking about if you have a history of multiple miscarriages, so you may develop this gestational diabetes. Then before conceiving, if you were having a hormonal imbalance like thyroid or PCOD, so again you're prone to this gestational diabetes. Then last but not the least, if you are having pregnancy, if this is your second pregnancy, in the first pregnancy if you're having gestational diabetes, so definitely in your second, third pregnancy you're prone to it. So these are some causes of gestational diabetes. Now I'll be talking about the treatment, how you can treat. First is when you're pregnant, generally doctors suggest get your sugar test done between 24 weeks to 28 weeks. If in case, first is fasting, in which you have to go for a sugar test which is empty stomach. Second is GDD, in which you have to take 75 grams of glucose. Post 2 hours you have to give your blood samples, right? So if you're in fasting, if your levels are coming less than 100, then you are fine. If in GDD your levels are coming less than 140, then you are not lying in the category of gestational diabetes. But if your levels are little high, let's say fasting is fine, but in GDD your levels are high, so then we have to go for some diet modifications. Secondly, if both the time in empty stomach, or I would say in fasting and in GDD your levels are high, very high, then definitely the second thing is medication, right? So I can tell you some tips how you can regulate your sugars, how this can be prevented. So first step for diet modification is that you have to have frequent meals, right? For example, if you're taking your meals after every 2.5-3 hours, is very much recommended during pregnancy. Second, if you're not having sugary things, like you're taking a lot of chocolate, cookies, generally being pregnant you take the privilege of it and you start having whatever things you wanted to. So this should not be followed. So try not to have things which are very sugary. Third, there are two types of carbohydrate. One is simpler, other is complex one. So if you're taking complex carbohydrate, it will definitely regulate your sugar. Complex carbs are like, if you're taking a lot of veggies, if you're taking poha, upma and adding a lot of veggies in it, if you're taking oats, dalia, if you're taking a lot of salads, if you're taking fruits which are not sugary, so these are complex carbs. Dry fruits, dals, they are considered to be complex carbs, and proteins also. Then if I'm talking about simpler carbohydrates, so let's say sugars, let's say sweet fruits, let's say rice, juices, potatoes, they're considered to be simple sugars. If you're taking a lot of amount, will definitely give you a lot of sugars. So try to stick on complex carbohydrate, or try to take a lot of proteins in your diet. So if you can add egg to your diet, if you can add kacha paneer or maybe anything from paneer, if you can add milk oats or milk dalia, it's a very good a good source of complex carbohydrate. Then if I am talking about your activities, right? If you are having inactive or sedentary lifestyle, then definitely you're prone to gestational diabetes. But if you're active, if after your meals you're walking for 30 minutes, let's say after lunch, after dinner, if you're taking good 30-40 minutes walk, so definitely your blood sugar will regulate. But if you're not taking walks, if you're lying down on bed doing nothing, having a lot of sugar, so definitely you will put on a lot of weight and you are prone to gestational diabetes a lot, right? This is diet modification which one can do and prevent yourself from gestational diabetes. Now, what are the risks of gestational diabetes? So first risk, if I'm talking about, is you can have the chance of C-section can increase if you're having gestational diabetes, right? Second, big size baby, right? Third, premature delivery. Fourth, after baby birth, baby may have some respiratory disease. Fifth, your amniotic fluid may increase, and again, if your amniotic fluid increases, the sugar levels of female increases, and that ends up to C-section. So these are the risks which you may face if you're having gestational diabetes and doing nothing about it, right? So I would suggest, yes, pregnancy is a very beautiful experience, but it comes with a lot of responsibilities. So please try to modify your diet. Try to stick to a strict routine or regime. Try to be active throughout your pregnancy. Try to do some antenatal exercise. If you're not able to do it, at least do walks. At least be active, and at least have diet which can control your gestational diabetes. So thank you so much for watching my video. I hope you liked my video. So please watch, subscribe my channel, and for any other queries you can go to my FB page. The details are given below, and do like my channel. And if for any appointment or any further queries, you can ping me on my FB page. Thank you.